Well, in today's Baby Talk segment, we're talking to Dr. Bobbie Colbert, and we're going to be talking about not only the flu season, but getting that flu shot. Now, when exactly are the dates of flu season? What is the range?
Well, the recognized time for the flu season is October through January. However, we start immunizing in September, and sometimes we'll even go through April, depending on the availability of the flu vaccine.
And one of the hardest things for parents is to see their baby get those shots. But I know that you're saying that it's something that should be recommended. Kind of talk about this year's shot in comparison to years in the past.
In the past, we've had a trivalent vaccine, which means that there have been 3 of the strains of flu that are common to this country that we protected from, and we've had to guess about the 4th. In other words, we would protect for 3 types, 3 strains, and if it happened to be that 4th strain, which we didn't protect for, then they would be susceptible to the flu. However, this year, for the first time, we have what's called a quadrivalent vaccine, which means we cover all 4 strains of the flu that are common to this country, and which means you should get about 95% protection from the flu.
And in comparison to years past, what was the percentage usually?
Usually about 75% average, 75 to 80% protection. But with the quadrivalent vaccine, we believe that we'll cover all strains of the flu that are common to the country, and so we should have a much lower rate of influenza if people get their vaccine. And if we're active in immunizing.
Absolutely. Now, when you have mom comes in and she's weary about getting her child another shot in the flu vaccine, what do you talk to them? How do you kind of ease their comfort?
Well, I sort of talk to them about the flu in general and who's affected most commonly by the flu. And it tends to be the very young and the very old who succumb to the complications of the flu. And that is how I lead into my recommendation that they give the child the flu vaccine.
And so, with that said, do you find that a lot of parents are going ahead and getting the flu shot this
Absolutely.
year?
I've seen much less resistance this year than in the past. And when we mention that we have a quadrivalent vaccine which covers all 4 strains, and so it's no longer a guess, they feel much better about it.
Yeah, because 75% to 95%, I mean, that's a nice jump.
Well, yeah, I think that covers it.
Absolutely. So are there any kind of drawbacks to getting this shot?
Well, depending on the type of vaccine, there are 2 types of vaccine. There's the attenuated live virus vaccine that is given intranasally, and then there's the regular vaccine that's been given in the past that is not a live virus, and it's given by injection. And we have both types. And depending on the person's history of allergies or asthma, or whether there is someone in the family on chemotherapy, we will give the vaccines dependent on those issues.
Okay, but no kind of drawbacks with actually getting the shot or anything like that?
Sometimes you can get some mild cold symptoms, upper respiratory symptoms, maybe a low-grade fever, but that's usually the extent of it.
All right, well, Dr. Colbert, thank you as always. Great expertise. We appreciate you.